Again, I want to welcome you all to our Healthy New Moms webinar series. My name is Roni, and I work as the Child and Family Program Manager at the Mental Health Association of Maryland. Healthy New Moms is a program of the Mental Health Association that works to raise awareness of perinatal mood and anxiety disorders and offers support and resources to moms across the state. You can learn more about Healthy New Moms by visiting www.mhamd.org. So today's session is being recorded and will be made available to you in the coming week. We'll talk about this more at the end, but certificates of attendance are available. And again, we'll share more information at the end. So diving into our webinar topic for today, according to the NIH, at least 5 million acts of domestic violence occur annually to women aged 18 years and older. Additionally, other studies note that approximately 6% of women who recently have given birth experience emotional, physical, or sexual violence during pregnancy by a current intimate partner. In honor of National Domestic Violence Awareness Month, this month's webinar will discuss domestic violence, risk factors, and patterns. It will also discuss the increased risk of domestic violence during pregnancy and newborn stages. It will discuss the increased risk of domestic violence, and we'll highlight how that so much information is available for mothers and families in the community and how we can support them to safety plan. Lastly, we'll review child maltreatment during the newborn periods, risk factors impacting child safety, and how to respond if you or someone you know are concerned for your child's safety. So today we have three wonderful speakers joining us. GBMC Safe and DV Victim Advocacy Coordinator Danny started her career in crisis intervention at 18 years old. Danny started at the YWCA of Annapolis and Anne Arundel County working at the Domestic Violence Non-Disclosure Safe House. She answered hotline calls and was a hospital responder while obtaining her certification for substance use counseling and her degrees in human services and substance abuse counseling. Danny continued with the YWCA until she took on a position as a substance abuse aftercare coordinator for one of the largest parcel service carriers in the world before being promoted to the case manager for the West Coast Division. Danny continued working there until a position with the Maryland Transportation Authority Police at BWI was offered to her. Danny then transitioned to the Dove program at Northwest Hospital, where she worked as a law enforcement advocate. Danny partnered with the Domestic Violence Coordinator and Baltimore County Police Precincts 1 through 4. Danny would partner with officers to complete high danger and non-high danger home visits to assist victims of intimate partner violence and help them receive assistance. She also worked closely with the victims to obtain protection orders and has now taken the role of advocacy coordinator at GBMC. Danny enjoys giving presentations, training new PRN interventionalists, and traveling to workshops, but enjoys being an advocate for patients first and foremost. Our second speaker today, Danielle, is the Child Protection Program Coordinator at GBMC. Danielle received her bachelor's degree from Wingate University and received her master's degree in applied psychology from Francis Marion University. Danielle has over 15 years of training and experience in the field of child abuse, child advocacy, and child trauma treatment. As Child Protection Program Coordinator, Danielle works in partnership with the Child Protection Program Medical Director, coordinates with local child protection and investigative agencies, and provides education for members throughout the community. At GBMC, Danielle and her team respond to all concerns or reports of child abuse, maltreatment, or trafficking presenting at the GBMC Emergency Department and throughout the hospital. And our third speaker today, Sarah, is the first advanced practice nurse to hold the title of Director of Child Protection at GBMC. In her former role, she was a nurse practitioner at Children's National Medical Center in the Department of Trauma and Burn. Before that, for 4 years, she was the sole advanced practice nurse at Johns Hopkins Hospital on their child protection team. While in that position, she established an evidence-based algorithm for evaluating patients with concerns for accidental trauma, including creating a 24/7 multidisciplinary consult service within the institute, extending to outside the hospital entities. Additionally, while in that role, she immediately identified gaps in education within the Institute. Sarah began an education program to include monthly resident and fellow education and was integral to the new graduate nursing orientation program addressing early identification of child maltreatment in the pediatric emergency department. She initiated quality improvement measures aimed at near misses and identification of maltreatment in the emergency department. Sarah has been a speaker at Maryland Child Abuse Medical Professionals quarterly meetings, as well as a presenter at the American Pediatric Surgical Nursing Association. Her research interest includes early identification of child maltreatment and the prevention of sentinel events. She has testified as an expert witness in child abuse in Maryland. So I want to thank all of our speakers for being here today, and I will hand it over to you.
Hi, thank you for those introductions. And so, as Roni said, we will be talking today about intimate partner violence and about child maltreatment, and just how both of these risks present during the prenatal and postnatal newborn time frames. So, I am going to share my screen now. So, I'm Danielle, the Child Protection Program Coordinator. This is Danny.
Hi, I'm Danny Ambergolio. I'm the advocacy coordinator.
And then this is Sarah. She is the medical director of the Child Protection Program. So just give us a second. We will share our screens. I am going to say if you want to ask questions, you can ask them in the chat. Roni, I don't know how this is typically monitored. I know when we share our screen, we can't really see the chat. If you want to monitor that, or otherwise we'll review the chat by the end of the presentation and get to all of those questions then. So just give us 1 second and we will share our screen. All right, and let us just start this. Okay, so I'm gonna let Danny go ahead and start.
Hi, everyone. Again, I'm Danny Ambergolio, and Roni has already gone over the objectives, but the first thing we're going to do is the content warning. What we talk about, we do not sugarcoat, we do not make it less uncomfortable. So if at any point we are going to show triggering images, we will do a secondary content warning. But if you need to turn your camera off, you need to step away, it does not bother us. But please know that our job is to be as honest as possible. So content warning for everybody, okay? We already went over the objectives, but this is basically the rundown. We'll kind of go over each as they're happening. So what is intimate partner violence? In a nutshell, it's power control over another person. That can be for sexual violence, intimate partner violence, any type of abuse within a domestic relationship, and it affects everyone. Every socioeconomic group, every racial group, every cultural group, everyone. So what we use for my world, again, I'm the domestic violence advocacy coordinator, is this power and control wheel. It was originally created in the early 80s, 1982, in Duluth, Minnesota. If you look at each one of the wedges of the wheel, they have different corresponding violent tendencies. Now, it was in the 80s, so you'll see things such as using male privilege. That's going to be using head of household privileges now. Back in 82, man was head of household. And then you're also going to see in the bottom section, minimizing, denying, and blaming. That is now known as gaslighting. It is not a trigger word. They just put a name to an actual act. And the way that I typically will tell people when I'm doing these trainings is if you're told you're crazy enough, you eventually start to believe you're crazy. And it's downplaying the act truly to make someone feel like it's not real, it's not actual, that it didn't happen. Gaslighting. It is a huge isolation tactic. And then what we have when it comes to the beginning of most violent relationships is the cycle of abuse, or cyclone as it should more often be used, because in the beginning, you're going to have that honeymoon phase up at the top of the cyclone. It's this huge cycle. Honeymoon phase, it's going to be too good to be true, love bombing, all of the things that really build the connection immediately that make it so hard to leave. And once the honeymoon phase has kind of slowed, you're going to get to the calm. It seems to be when the relationship settles and the new love is gone and it's just normal. Then you get to the first round of tension building. So tension building is, I've had a bad day. Everyone's allowed to have a bad day. It's not an issue. And then the next step is the abusive event, or the explosion. And typically in inter-partner violence relationships, that first explosion is not a physical act. It's an aggressive act around the victim party. So it could be throwing a phone, purposefully missing them, punching holes in drywall, something along those lines. And then you immediately get back into the cycle, the honeymoon phase, so the apologies. And the apologies tend to come with, I'm so sorry, I love you so much that I couldn't control myself. You're the best thing that's ever happened to me. And it goes on in that cycle. And eventually the calm starts to diminish completely. The honeymoon phase gets extremely short. Tension building is really unnecessary, because it could be anything to be that tension building before the abusive event. So eventually at the bottom of the cyclone, you're at pure violence. And at that point, you're dug in, whether you have a child in common, financial stability, homelessness could be a reason for not leaving, isolation from family and friends, like we just saw on the power and control wheel, anything that would prevent leaving the relationship. And forms of physical abuse, I can go over all of them, but physical abuse is what most people think of as punching, kicking, slapping, but it can be anything that causes physical danger to another. So we say it when we teach teenagers who are just learning to drive. If someone is driving aggressively and they are putting your physical safety at risk, that is physical abuse. So it's a lot more than just the punching, kicking, slapping that most people think. Then we get into the emotional abuse, which is the verbal, the attempting to control how you present yourself, what you wear, what you can wear, what you can't wear, monitoring you, whether you are told you can do something, can't do something. It's the acts of jealousy. It is obviously the name calling and insulting, criticizing, and then threatening, whether it's direct threats or menacing. On what happens if you do not listen, or you do not do what the abusive party wants. A lot of times they are not threats that the law would claim as a threat. So in the eyes of the law, a threat is a verb. I will kick, punch, shoot, kill, slap you. A menace is, you know what I can do, or you know better, you know what's coming if you don't follow the rules. All of which is violence in the emotional and verbal aspect. And this is just a continuation, but we do highlight gaslighting there. So gaslighting, pretending not to understand or refusing to listen to you, questioning the recollection of facts, resources, trivializing the needs or feelings, okay? And I always make a specific slide for financial abuse, because this is the reason why people cannot leave. Not will not, but cannot, because if they are able to manipulate you financially, it's a lot more than just controlling the finances. It is more so limiting access to the outside world. It is basically ruining someone on a financial level, ruining a credit card, running it up, ruining your credit score, preventing you from paying the rent on your current apartment. So then you're blacklisted from another rental being available to you. They might make it seem like they are allowing you to be a co-signer on their credit card, which sounds amazing, but it's actually your name that they provided, and that you don't know that it's not being paid, preventing you from knowing the bank accounts, stealing money, not allowing you to work. And if you are working, deciding to start an argument, taking the shared card, not allowing you to go to work. So it is a huge, huge aspect, but we want to basically summarize it. And then we're going to move on to digital abuse. We are seeing this more so now than ever before, digital tracking. We talk about it with teenagers all the time. They are not used to not having 100% access to another person at all times. And we teach that it is important to have separation from your partner, from your friends, and having alone time where you disconnect. But digital abuse can be anything from sending negative or insulting, threatening messages to demanding to see where you are, demanding to FaceTime you in any given moment to know where you are, putting tracking devices on your phone, on your vehicle. There's also sextortion, which is pornographic images, whether they are shared mutually or they are taken without the person's consent, and then using it later on as blackmail or extortion. That is known as sextortion. And then sexual abuse. Sexual coercion can be anything from guilting someone into sex, using sex as a manipulation tactic, but also being aggressive in the sexual act. That sex is a consensual act, but when someone uses that and pushes the barriers or says no, and then the sexual act is continued, anything after that no or non-consensual contact is a sexual assault. So it could be anything from just being too aggressive to a rape. It could be anything from sodomy, forcing someone to watch or make pornography, involve people in sexual activities with you. And then also we say choke. It is actually strangulation. So strangulation during a sexual act, when we're seeing it, we're talking about children here, we are seeing it younger and younger during consensual acts because it's in porn. So we are seeing young teens, their first, second, third consensual sexual act are being strangled because it's what they see in pornography. So we want to make sure that we have an open, honest conversation about what is and isn't okay. If it's going to physically hurt you, it is not a consensual act. And then medical abuse, preventing you from going to a doctor, preventing you from seeing a doctor and being honest with them, denying access to transportation for medical appointments. If you are being taken to the doctor, they get to be in the room while the doctor's having conversations with you. They get to tell you on the drive over what is and is not acceptable during the conversation. And then we also have reproductive coercion as medical abuse in its own subcategory. That is controlling whether or not you use protection, lying about hysterectomy, vasectomy, breaking or removing condoms during sex, lying about methods of birth control. Preventing you from going to any type of OBGYN, OB, any type of doctor's appointment that you may need. Now, we also stop here and we say that it is a big part of what Danielle and Sarah are going to do. We're going to talk about that in a little bit, but reproductive coercion, we're going to come back to that. And why? Why is that reproductive coercion such a big concern, especially with the three of us? Because when we, when we see people who are either pregnant or they've just delivered, we see a huge uptick in domestic violence, and we either see it start or severely escalate. That's during birth or the first 3 months after birth. And why is that? Well, the way that I break it down to most people is look at it from an abusive party's mindset. During pregnancy, the bigger the belly gets, the more attention is drawn to mom, right? That's who everyone cares at. The bigger the belly, everyone wants to touch it. That's when she needs to put her feet up. That's when you should be cooking and cleaning for her. Now, the rest of the world is paying attention to her, but behind closed doors, I can almost guarantee you she's still focusing on abuser. Then what happens in the delivery room? You have a room full of medical professionals who are focused on the partner, the victim party. And again, we're talking about during delivery, so the majority of the time, the biological father. He is in the way. He just is. He is not important in the moment. Everyone is caring for the medical needs of mom and then baby. So imagine having 5, 6, 7 people in a room taking care of your partner, and you are truly just in the way. That's going to elevate someone aggressively. But mom still cares about dad. No one else does in the moment. The totem pole, you're very low. Now, 3 months after delivery, everybody cares. Everyone cares about baby number 1. Mom is number 2. Dad isn't on the totem pole. It's when we see the violence escalate exponentially. Okay.
And so then we're going to lead into kind of the risk factors. So we talked about what domestic violence is, what you need to look for, and that it does increase during the prenatal and postnatal newborn periods. And then we're going to talk about how domestic violence, and we do use those terms interchangeably. Intimate partner violence is the more appropriate term and more accurate term, but if I say domestic violence, I use that language interchangeably. But how domestic violence impacts children. So exposure to intimate partner violence increases a child's risk to other forms of abuse and violence. And over 1/3 of families with IPV will also have co-occurring child abuse. And so that'll lead us into our discussion on child maltreatment, but just a few more statistics. So children who have witnessed IPV, and again, we try to get this information out there because a lot of times we have moms who are trying to protect their kids, right? Trying to protect their kids before they even protect themselves. And then we have moms who are trapped in a situation, or they don't have a way to get out, or they haven't safety planned a way out of an abusive relationship yet. And so they are trying to protect their kids, or they're trying to say to themselves, well, it's just me. Like, I can handle it as long as I can help my children. But we just want to let you know that there are correlations. And so children who have witnessed intimate partner violence are 8 times more likely to experience neglect. They're 10 times more likely to experience sexual abuse in their lifetimes. And within the past year, children who have witnessed intimate partner violence, 20% of them have also experienced physical abuse. So where in families where violence is present, other forms of violence often coexist. And we could do a whole other, presentation. There's lots of information out there about how child abuse, how trauma impacts children. But what we want you to know is that, this does impact children. Intimate partner violence does impact children, even if they are not directly being hit themselves. It also, in the state of Maryland, it is a higher, so when police are involved, it is a higher level of crime if a child over the age of 2 has been in eyesight or earshot of a domestic violence incident. And again, that's because these incidents do predict them or do impact them. These incidents of domestic violence are also very unpredictable. So the child's safety risk, we consider it a very high risk situation because intimate partner violence can escalate so quickly and can go from yelling and maybe throwing objects to becoming more deadly or a risk of lethality. And then, of course, other risk factors during the newborn period that, again, just put children at risk for maltreatment. We certainly have postpartum depression and anxiety. We'll talk a little bit more here about what abusive head trauma is. It was previously known as like shaken baby syndrome, but there's so much more to that. So now it's known as abusive head trauma, and we have a lot more information about what can cause that. As far as the different just like traumatic impacts to the head. Stress obviously is a risk factor during the newborn period, which can be, purported by the sleep deprivation, by everybody in the family, by mom, by baby, by dad, that sleep deprivation isn't helpful in for anybody. And then also the baby's never ending needs, right? So a baby, some babies, you know, cry more than others, but babies are always needy. They can't do anything for themselves at this point. They need somebody to help them survive. And that can be stressful. That is stressful. And so all of these things just lead to an increased risk for maltreatment during the newborn period. And I'm going to let Sarah take it over from here.
So I wanted to introduce you to a mnemonic that is basic but extremely helpful in the immediate newborn period, as you navigate like we spoke about, the stress of bringing a new baby into potentially an already quite stressful situation. So the letters that I want you to remember are purple. The mnemonic stands for P, means for peak of crying. So meaning that your baby is going to really cry more and more in the month 2, and then that will peak and then decrease in months 3 through 5. So we do see, and it's proven by the literature and by our experiences in the hospital, most of our patients and families that we see for abusive head trauma or any of the abuse that we're going to talk about in a few slides really is in that 2-month period. The reason being is similar to what Danny spoke about in the honeymoon period. Those first couple weeks that you bring your baby home, you have a significant amount of support. You're in a honeymoon phase, the baby is cute, you know, you potentially have family members that are over helping you or neighbors that are bringing you food, and that'll dissipate in a few weeks after the baby being home. And so the real risk for abuse happens after those support systems have left, and it's potentially just you and the baby, or you and another person in the home and the baby. Babies crying can be unexpected. There is no reason for it sometimes. They have basic needs of being hungry and wet. And so once you've met those basic needs, we instruct you just to put the baby down in the crib by themselves, knowing that babies crying is unexpected and unpredictable at times. Sometimes when you attempt to soothe the baby, they may still continue to cry. Again, if that's happening, to put the baby down in a safe space, the crib, and walk away. Babies look like they're very uncomfortable during this crying, which can lead a caregiver to want to do more. This is the start sometimes, particularly with a person where they already may have a low threshold for this level of crying, may start to intervene to get the baby to stop crying, because it can be long lasting and they can cry for hours a day. It typically happens more often after dinner time, which when people are tired, people are coming home from work. Oh, you've been up all day with the baby. So these are the things to look for. Anytime there's a baby that's crying, assure them that they've been fed and diapered, and then you can place them alone in the crib and walk away. They're never going to be injured from being allowed to cry. Nothing bad happens when babies cry. The negative consequences come from if you react negatively to a baby crying by potentially shaking them. So what is important to know is some basic key developmental milestones in the newborn period to help set expectations for what you may see. Around the 2-month age, they start to lift their chest off the table, and around 4 months of age, they start to roll from front to back. Again, that's where you see that 2-month period is where that start happens of some of these developmental milestones, and so that's what seems to correlate when we see this peak in the crying as well. Babies want to start to move, and when they're frustrated as well, they can start crying. Around 6 months, they start to sit on their own. Around 8 months, they start to pull up to stand. And at this point, babies can move around in their environment and need additional supervision in terms of getting into things and potentially injuring themselves. Around 9 months, they'll start to cruise on furniture such as sofas. They then go to walking, and then finally will learn to go up steps. So sentinel injuries are a particular interest of mine. We see a significant amount of cases in our emergency room where a mother in particular has noticed something different about her baby. and often is in scenarios where there's been domestic violence reported, but has been too scared to report the concern or didn't know what it was. So my job here is to educate you on what you may see and what to do next about it, because these are really relatively minor things that you're going to notice. The key is that they occur on a baby who's not moving. So prior to that 6-month mark, we don't really have, the family typically doesn't have a good explanation for it, but these are things that clue us in that something abusive could be happening. These are not injuries that happen in the normal care of a newborn, but are typically very visible right away, but heal without needing to go to the hospital. The takeaway here is anytime you see any bruising or mouth injury in a baby who's not moving, you need to be concerned. And so this is a trigger warning. These are some of them are real pictures that we blurred the faces out, and some are from textbooks. But I wanted to show you some common injuries that we see in the emergency room of babies, so that you can also recognize these in your own children. So concerning injuries, these sentinel injuries, or any burn in a baby who's not moving, a nursemaid elbow, which is essentially it's a toddler or school age kid. If somebody yanks on their arm, that it can get dislocated from the socket. Essentially, we would not expect that in a newborn baby. Anytime there's red or blood in the whites of the eye, this is one of the most common presentations that we see in the emergency room when we ask moms or caregivers to go through their phones and look at potentially things that would, when they recall events, or it can sometimes be in the setting of a domestic violence scenario, and the parents will pull up photos and I'll be like, when did you notice that in their eye? And sometimes mom never recognized it, or she did but didn't know what it was. So it's actually bleeding in the whites of the eyes, and we should never see that in a newborn. So that should alert you, and we'll talk about what to do next. Bruising, anytime there's bruising in a newborn, that should alert you that something is going on. We see it typically very subtly. It's usually just a small area on the chest wall that could indicate somebody squeezed the baby. Moms generally understand when there's a lot of bruising that something's wrong, but those little subtle bruises, take a picture of them, and we'll talk about that later, but take a picture of them and they should raise red flags for you. And again, anything in the mouth that is injured is concerning. So here's some additional photos. I wanted to emphasize how subtle some of these injuries can be. Both of them are on the cheek. There was a different story provided from each of these. These are actually both real patients I saw when I was working at Hopkins. One of them was reported in the setting of feeding a baby. They left that bruise, which is not at all expected. And the other one was in the setting of giving mouth to mouth during resuscitation. Both of these children presented to the emergency room with additional injuries consistent with shaken baby syndrome. I wanted to emphasize, though, how subtle the external signs or the skin findings are that we get with these horrific injuries. On the picture on I guess your right, I hope, is a picture of an eye. That is an example of that bleeding or the red in the whites of the eyes. A lot of times it's subtle and sometimes only noticed when we go back through photos of baby pictures, because what do moms and parents do? They take pictures of their babies, and then we notice it then. And then the other picture is actually a picture of a mouth. It's the top part of the mouth. There's something called a frenulum there. It's a piece of tissue. And in the setting of force feeding a baby or hitting a baby in the face, you can get that injury. So if there's ever a time you see that in your baby, you need to contact a medical provider right away. So this is a mnemonic. I don't expect you to remember it, but know that it's out there. It's called 10-4 Faces P. And what it does is it lists out all the areas as mom's caregivers you would not want to see injury on your baby. So anytime the baby's trunk or abdomen has any injury on it, that's concerning. That is a very protected area of a baby's body, and not something that you would should notice injury on. Ears are interesting in that even as an older child, you shouldn't expect to get any ear injuries on children. There again, and think of places that are protected or over large protected areas. The ears sit on a very protected area of the brain. And so if you see an injury or particularly a bruise there, there's often underlying injury there. The neck, like Danny noted, strangulation is something we see a lot. The neck is not something we would expect any marks on. The frenulum we talked about in the mouth, the cheeks, the eyes, the whites of the eyes. And then if you notice anything in a pattern, like a loop mark, those are should alert you that something is going on.
And so we've talked a little bit today about kind of the basics of what is intimate partner violence, almost what quote unquote counts as intimate partner violence, as well as what are some signs that you should, if you notice these things, they should give you a red flag, or you should be aware or look further into if you see these injuries on your child. And so now we're going to go into just what if you do notice something like this, or what if you are experiencing intimate partner violence, what's available for you and what should you do? So obviously, so we'll start with first with child maltreatment. If you are concerned for your child, if there's an emergency, please call 911. We actually also work with the, at least in Baltimore County, I think this is statewide, but we're located in Baltimore County, and we work with all of our paramedics and EMTs here to give them training about child abuse as well. But please call 911 if you're concerned about your child's injuries and you don't have transportation or something along those lines. Like if you're concerned, if your gut says call 911, call 911. That's what the services are there for. I know I've had several of my friends who, when they're in, the newborn period, they're like, is this concerning enough? And almost, I feel like a lot of moms will question themselves and question, is this enough? But use your gut feeling. If you're questioning it, if you don't have another way to get your child seen, if it is an emergency, please use 911. Also, like Sarah had said earlier, so if you notice some of these injuries, like if you notice bruising on your baby and your baby is not at the point, so we say too, like, if they can't cruise, they can't bruise. So if they're not up and moving around themselves to where they can hurt themselves, they shouldn't be bruising. But take pictures. Those pictures are then time-stamped to keep notes. Like if you notice something and there was something concerning that happened, or something that, in hindsight, you're like, oh, maybe this was not okay. Take notes. Keep those notes in your phone. On a lot of phones, you can take notes under the picture as well. But so take pictures, keep notes. Also, take the pictures as soon as you notice them, because injuries can change quickly. And so again, this is important to document so that you can show medical providers or anybody that needs to see them. Also, utilize your primary care provider, so that child's pediatricians. Call them. Again, a lot of at least my friends are always like, "Is this enough to call?" Yes, it's enough to call. Call your pediatrician. Ask questions. Follow your routine visits. Stay in communication with them. Don't feel like anything is too small of a concern to bring up. That's what they're there for. They are there for you as a resource, as well as to be a resource and an advocate for your child. So use them. We also have, the Child Protective Services hotline. This is a statewide number, so no matter where you are in the state, 1-800-91-PREVENT. So that is where you can call if you have concerns that somebody is maltreating your child or abusing your child. They also, every division of Child Protective Services, or every jurisdiction, every county has services available where if you need support, they can help to support as well. So you can call and say, these are the concerns. If you're having, and they can direct you to where those support services are, or how you can access those support services. And then last but not least is the Maryland Children's Alliance. If you Google that, so that is the kind of directory of where your local child advocacy center is. And what a child advocacy center is it is a entity, and they're all throughout the nation. But it is essentially a building or an agency that's housed or houses the child abuse investigation team. So if you're concerned again that abuse may be occurring, you can always call the Child Advocacy Center and get direction for what to do next, or what services may be available in your community to be able to prevent some child abuse as well.
And for intimate partner violence, for any type of resources, I primarily work within Baltimore County, but these are the programs that we use here. Dove is on the Randallstown, Catonsville, Pikesville side. Then you have Family Crisis Center, which is the Dundalk, Essex, White Marsh. Here at GBMC, we primarily use Turnaround because they're right smack dab in the middle. But what I want to really emphasize is safety planning. With any agency that's contacted, safety planning is going to be individualized per patient or victim. We say patient here at the hospital. And there's no real way to break down a safety plan. Rule one of safety planning is you don't write it down. If you write down what you're doing, someone could find it. But it could be anything from building a small honeypot little by little for years. It could take years to leave a domestic violence intimate partner relationship. And any agency you work with is going to know that. Step by step, little by little. It takes the average victim of intimate partner domestic violence 7 attempts to leave before it's successful. So we know that planning, preparation, and truly understanding what is a safety plan is top priority. So each one's individualized, but I can tell you that the kitchen and bathroom are the most dangerous points in the home because every surface is a weapon. Everything on those surfaces are weapons. They're typically very tight and enclosed. So we recommend if the abusive party is escalating to somehow move yourself out of either of those rooms into an open area. And if possible, which we know every instance is going to be different, if possible, put yourself closer to the exit, whether that is the back door, the front door, sliding glass door, whatever it is. And then always having your bag close by with your keys top and easily accessible. If you have to get out, do not struggle to find your keys at the bottom of your purse. Make sure they are sitting up and you grab the car key first. Inside Baltimore County, I'm always hesitant to say this because I'm not sure where everyone is from. Inside Baltimore County, you can text 911. The first message is the address in which you need assistance. If you are unsure, if you are currently in the county, if you are driving, you're on 695, you are for sure in the city, Anne Arundel, Hartford, Howard, Cecil County, do not waste the time in texting. It will not work. That is a Baltimore County specific resource. But if you are looking for resources outside of Baltimore County, I highly, highly recommend going to Maryland Coalition Against Domestic Violence, because you can actually Google your specific area, county, and then address wise, and it can get you situated with the Intimate Partner Violence Agency in that area. Okay.
And so that is our very brief presentation for you today. We know that what we talk about can be upsetting, it can be scary, it can be anxiety provoking. But again, we want to get the information out there so that you know that there are supports available, so that you know what to recognize as red flags, either within your own relationship or things to do with your child. And again, we believe that education is power. So we wanted to just go over the basics with you today and give you a brief overview of some risks that you may face during the newborn or prenatal, postnatal period. So if you have, we appreciate you taking the time to listen to us today. If there are any questions, we can go over questions right now, and we'll keep sharing our screen for a little bit. So if you have want to write that number down. So this is how you can contact us if you have questions or anything that you don't want to talk about on this forum, you can call. We have one local number where you can reach all of us. It's a secure voicemail as well. So if nobody's available, you can leave a voicemail, and only people within our team have access to that. And you can reach us at 443-849-3323. And again, you can reach all of us there, and we can each talk to you further.
And just to piggyback, we don't want to use this as an emergency line. Emergency line should always be 911 or a local police precinct or anything like that. This is truly an office number, Monday through Friday. We can be found, so please do not use this in the event of emergencies.
Thank you so much. This was such a insightful and powerful presentation. We do have some moments left. If anyone does have any questions, you can feel free to either come off of mute and share, or you can drop it in the chat and I can read it off. But we do have some time if anyone has any questions or anything that you want to share. Okay, not seeing any. And someone shared in the chat, fantastic presentation. You all provided plenty of useful information, and I definitely second that. Okay, so not seeing any, we will close for today. Again, I want to thank you all so much for taking the time out to join us for our October Healthy New Moms webinar series. I want to extend a special thank you to our guest speakers, Danny, Danielle, and Sarah, and GBMC Safe and Domestic Violence and Child Protection Programs. We will, at the end of this, share a follow-up email with a link to the recording and the presentation. There will also be a survey asking for your feedback on how we can just continually improve these webinars and make them impactful for you all. So like how I shared, certificates of attendance for today's webinar are available upon request. You can click the link in the chat to request a certificate. These are not CEUs. These are just certificates to document that you attended this webinar. If you are interested in serving as a guest speaker for an upcoming Healthy New Moms webinar, you can click the link in the chat and someone from our team will follow up with more information. Please join us at our November webinar series on Tuesday, November 4th. The topic will be Fatherhood Matters, exploring the role of fathers in the perinatal mental health period. We look forward to working with you all again to support mothers and communities across Maryland. And if you have any questions, feel free to reach us at info.hnm@mhamd.org. Again, that is info.hnm@mhamd.org. Thank you all so much and have a great rest of your weeks.